good afternoon. This is an episode of In Conversation with Knights here at Hartus Congress in Rome. And here is Dr. Ursula Catena from Gemelli, whom I thank you and welcome to our
Hello, Serena.
space.
Thank you.
The first question we want to ask to Dr. Catena is what is the kingdom you identify with, and do you exclusively identify with one kingdom or more?
I'm from the kingdom of hysteroscopy, but all the day I deal also with the ultrasonographic kingdom.
And in your opinion, question number 2, what is your best weapon in the infertile patient management?
I think that the most important thing in infertile patient is a correct diagnosis of the uterine cavity and then a correct instrument. We know that nowadays we have a lot of very good instruments. The technology have improved a lot in the last years, so I think that doing inside the uterus a surgery in the correct way can improve the spontaneous fertility of our patients.
Thank you very much. Next question is, if you could fight for only one update or modification of the latest recommendations in the infertile patient workup, what would it be?
I think that there are a lot of work to do nowadays from a scientific point of view. First of all, I think that we had to find an agreement on the way in which we study the uterine cavity for infertile patients, that it is totally different from our pathology, and then trying to speak the same language about uterine malformations and the treatment of that.
What is your unpopular opinion compared to the other knights in your kingdom regarding the infertile patient workup?
Difficult question. I think that another time we have to deal with the way in which we evaluate the uterine cavity. If different people perform an hysteroscopy to an infertile patient, we can have very different answers, and I think this is what we have to try to change today in our kingdom.
Okay, thank you. The next is, what is the most medieval practice in your kingdom for the infertile patient workup?
DNC. And I think that dilate the cervical canal for every pathology is another medieval practice, so I think that we have to continue to pushing on a vaginoscopic approach, on the use of miniaturized instrument, in particular in infertile patients, so totally avoid the blind procedure, but also trying to avoid the dilation of the cervical canal if really not necessary.
For the purpose of the win, that is reaching the fertility outcome, who has the strongest power as an alliance among the other kingdoms?
I think that the stronger alliance to treat patients with intrauterine pathology and problem of fertility are hysteroscopy with ultrasound, because we can manage intramyometrial pathologies and guide our surgery.
If you could duel with only one knight belonging to the other kingdoms, who would he or she be?
Only one. Only one for infertile patient. I think that the name I choose is Campo, because he's one of the master in treated hysteroscopically infertile patients, and so surely Campo is the name.
Thank you very much.
Thank you, Serena.